Good morning, all of you. I myself, Professor Dr. Shyamsundar Kakani. As far as your NTET is concerned, the one topic I want to introduce here, that is the bedside teaching or the clinical methods of the teaching here. What's its importance? Clinical teaching is as such a evidence based. If you want to put Ayurveda as a main stream of the medical science, this is a blame on the Ayurveda that they don't have the proper evidences. So, to develop the clinical knowledge in your learners, in your students, the perceptor, that is the teacher or the demonstrator, can access the students' critical thinking, clinical reasoning, and experimental learning here. The clinical method teaching approaches with the view with equipping the learners with the knowledge of the skills, attitude essential for the clinical practice. Furthermore, bedside learning enhances the communication skills, enabling the students to establish the meaningful connection with the patient. The students, their theoretical knowledge, what they earn during their learning sessions by the bedside training, the theoretical knowledge along with the practical knowledge, this approach make their ideas, their views about the acquired theoretical knowledge to become more and more sound. The clinical teacher becomes a role model for the students. This is much more important. If your teacher, your preceptor is having a good in-depth clinical knowledge, a teacher can express and convey the experimental knowledge in eco-friendly environment to the students, boost their ideas, boost their line of thinking during examination of the patient, during taking the history of the patient, during studying the different reports, and develop the ability to conclude and put the remarks over the selection of line of treatment. This is the ideal role of the teachers. The teacher's professional behavior can have the positive effect on the students, whereas unprofessional behavior may have the negative effect on the students. The teacher, he himself or herself have the detailed knowledge, whether that is a surgical procedure, whether that is a panchakarma procedure, whether that is a evaluation, the clinical aspect, to understand the disease and the disease progress, the prognosis of the disease, and the selection of the disease along with the differential diagnosis. All these things impact on the students if the teacher is approaches with the practical aspect, that type of skill, that type of behavior, that type of attitude develops in the students. The bedside clinic is a process in which a clinical teacher and a group of learners examine a patient, verifies the physical signs, discusses the provisional diagnosis and the line of treatment, particularly associated with the disorder or particularly associated with the disease, and collectively, individually or in group, collectively plan accordingly the health services for the patient here. So, this is the important aspect of developing the skills right from the examining, taking the history, and up to the line of treatment. What are the chances of the prognosis that can be easily discussed in the groups, and the teacher, the professor simplifies the ideas, the line of thinking, whether that is in a correct direction or what it needs more to endorse the diagnosis and the line of treatment. At any time, if required, any investigations, the reports received that should be explained properly to the students, and this is only possible if the teacher himself or herself having a good knowledge, able to transfer the knowledge in a simplified way in order to understand the disease as a whole to the learners. Different types of bedside teaching techniques are adopted. There are 5 stages. First stage is preparation. Second stage is introduction. That teacher should introduce the students to the patient. Introduce why the students are here, What is the importance of the bedside teaching for the students? That should be neatly, cleanly, softly explained to the patients so that the patient will cooperate. Patient will give the details to the students so that the students can conclude his observations. The third stage of the teaching, bedside teaching, is observations and the teaching. What the teacher observed, the teacher's observations, what the students observed, their observations. The teacher should explain what is the meaning of the observations noticed, what are the chances, what will be the differential diagnosis there, what is mentioned in the text, and what practically you noticed during examination of the patient. So this is a teaching method of the teacher who should explain the observations to the learners. Next point is discussion and reflection. During the group discussions with the learners, the health professional should discuss the line of treatment, whether that is a medicinal or the surgical, what procedures it requires, what modalities will be beneficial as far as Panchakarma and all the Anushas karmas are concerned. That should be discussed in the group of the learners. Teacher should explain the benefits of the selected procedures, the line of treatment. The teacher should explain in the group discussion what is the meaning of the diagnostic tools, that may be invasive, non-invasive, laboratory investigation carried out, and how they are related with the disease. That should be discussed during the bedside teaching. And at the same time, the reflection noticed during the disease procedure, the each and every stage of the disease should be explained properly. The symptoms noticed, the observations noticed, that can be discussed among the learners by the health professionals. This is the type of method here to as far as bedside teaching is concerned. The last fifth point is follow-up and closure of the case. What is the importance of the follow-up? What is the importance of the noting the vital signs? What are the importance of the progress you noticed? If require any investigation, if require any second opinion, if requires to change in the regime suggested. So all these things, the behavior, the progress, the health, that may be toward the positive side or toward the negative deterioration of the patient, that should be particularly how that is important, that should be emphasize, discuss, to take the notice during the day-to-day follow-up. And if noticed, patient can be discharged with a positive or negative note. That closure, how to close the case here, then the discharge summary, importance of that, line of treatment suggested at the time of discharge, and more important, that is when you advise to visit again, that is the follow-up date. All the importance should be, all these points teacher has to explain the importance of these points and how to close the case here, the case study here. In some or the other case, if bad, that is the in bad prognosis, if you refer the patient to the higher centers, if you refer the patient to the other department, if the death happened, then what type of papers, what type of death, how to write the death certificate, what is the importance for the hospital, what is the importance for the patient regarding that death certificate, the cause of the death should be, how that is important, that should be properly bring to the notice of the learners. And all these points are covered under the bedside teaching. This bedside teaching is having the advantages of structured and effective clinical education, systemic approach of teaching and learning at patient's bedside, bridge the gap between the theoretical knowledge and practical skill. Underline, this is the importance why the bedside training, teaching, because this is a bridge between the theoretical knowledge and the practical skill. So dear friends, all these points can be discussed during our in detail during our NTET course. The announcement of the course and the details of the course will be updated to you. So hope this introductory lecture about the bedside training. You how important for the health professionals and the students, the learners, that can be discussed in our teaching series. Thank you very much.